Hey folks, my name is Liam. I'm our senior account manager here at Compliancy Group. I'm going to be hosting the webinar for us today, and we're going to be exploring predominantly the question of, do I need to be HIPAA compliant? So for some of you, this may be something that you've tossed around. You may know that you need to be HIPAA compliant, but struggle to understand the reasons why. We're going to be unpacking a lot of that. And then also for those of you who maybe identify that you do need to be HIPAA compliant, some of you that may not be the best of news, because HIPAA can certainly be a complex and difficult undertaking for many reasons. We want to talk a little bit about the benefits of HIPAA compliance in terms of how this can actually have a positive impact on your business and even on your bottom line, how it can help you become more profitable, more efficient, whether you are a covered entity in a medical practice or if you're a business associate, either or. So one thing to keep in mind as we go through the webinar is that all of our webinars are recorded. So if you ever want to re-watch this webinar or check out some of our past webinars, feel free to go to compliancygroup.com/webinar. They're all recorded. We can get you the recording. You can shoot me an email. You can contact us directly. If you want the slides, we can get you those as well. You'll also find a huge amount of actually free resources on our website. So if you go to compliancygroup.com/blog, you'll find HIPAA checklists, white papers, articles, infographics, tons of content that may be addressing specifically the needs that you have. We have a lot of resources, especially related to telehealth coming out, since that's the new thing, a lot of people working from home. And as always, please ask questions as we go through the webinar. It actually makes it a lot more interesting if by the time that we get to our content, we have a good amount of questions that we can go through. It also allows me to just make sure that I'm talking about things that are directly relevant and applicable to the audience that we have. So as we go through, if there's anything that comes up that you're curious about, that you want a little bit more information on, or if there's just something that pops into your head and you want to address your situation a little bit more specifically, type the question. And so there's an actual feature in the GoToMeeting where you can ask a question. I'll be able to go through all of those at the end of the webinar and try to address everything before we close out for today. One thing to keep in mind before we go any further, I am working from home, and in our house, 2 o'clock is nap time for my 2-year-old and our 4-month-old. So you may hear, if at some point you hear a child crying in the background, everything's fine. It's just nap time. That tends to not be a happy moment for our 2-year-old. So just keep that in mind. Now, to give everybody, many of you may be familiar with Compliancy Group. You may even be a client of Compliancy Group. But for those who don't know really anything about us, to give you a little bit of a backdrop on who we are, our company, we've been around for about 15 years. And everything that we do, whether it's the free education we provide, whether it's our software or our overall service offering, the whole goal is to figure out ways to simplify compliance so you can confidently focus on your business. Because at the end of the day, whether you're coming to this webinar as an office manager in a small practice, or maybe the owner of your own practice, maybe you have a company or a service, you're a business associate and a vendor, chances are compliance is not what you want to be thinking about on a day-to-day or an ongoing basis. You more than likely are just trying to run your company or your business or your practice and do that effectively. So the whole goal of what we do is we want to help simplify that as much as possible. So we hope to do that throughout the course of this webinar today. But to give you a little bit of an idea as far as who you're speaking with in terms of Compliancy Group, we have been in business for 15 years. We have clients in 34 countries, all 50 states, over 400,000 users on our platform, The Guard. And in the history of our company, we have never had a single client fail any type of a HIPAA audit, investigation, or be fined, period, across the board. We have a very, very good track record. We don't just try to simplify compliance at the expense of doing this right. We have never had a client fail an audit because we ensure that for each of the clients that we're working with, that we're developing a compliance program that is tailored to you, simplified, and made effective. That's what we're all about. Now, that's just to give you a little bit of an idea so that you know who you're speaking with. We see a lot of misunderstandings in the market as it concerns HIPAA and even even questions about, who needs to be HIPAA compliant, you may not know. PHI, so for those of you that don't know, when it comes to HIPAA as a regulation, everything from a HIPAA perspective was designed to protect what the government calls PHI, or protected health information. PHI is any unique identifying information about a patient. Okay, there's actually 18 identifiers that the government has published, okay, along with it, and they have a kind of disclaimer at the end saying any other information that could be used to identify a patient, okay? But this could be things like names, emails, addresses, date of birth, social security numbers, not necessarily treatment-related information, okay? So that's one of the first things to address, is that any unique identifying information about a patient that is either being given to you as a covered entity or that you are sharing with one of your vendors as a business associate is considered PHI, okay? Now, all of that stuff, okay, in terms of what the government is looking to protect, okay, lots of misunderstandings that we often see. And one of the biggest ones is just on who actually needs to be worried about this. Now, compliance can become a little bit of a tangled web, and many people often have gotten into trouble thinking that they don't need to be HIPAA compliant, or that what they're receiving is not PHI due to the nature of their services. But a very interesting statistic is that 26% of the US economy actually falls under HIPAA, okay? 26%, so that's substantial. And it's because healthcare in many ways is both the most vulnerable and the fastest growing sector of the US economy. And there's so many different players that could be involved, right? So you have first, what would be the covered entities. This is any organization that collects, creates, or transmits PHI electronically. Simplest way of thinking about this is that there's 3 rules of thumb in terms of who could be considered a covered entity. So there's people that are involved in treatment, okay? So this is the hospitals, this is the doctors, the practices. So even optometrists, dentists, chiropractors, medical spas, many of them are covered entities, okay? All of those people, if they're involved in treatment, okay, of patients, that information is considered PHI. They need to be HIPAA compliant as a covered entity under HIPAA. There's then payment, so treatment, payment, and operations. Okay, payment could be an insurance company. Okay, operations could be a clearinghouse. It could be it could be any number of things, right? If what you're receiving is PHI and it's within a healthcare context. Now, the flip side of this is then business associates. Okay, a business associate is any organization that encounters PHI, okay, in any way as a result of the service that they are providing to a covered entity, right? So if I'm an IT firm and I'm providing ongoing IT management services that could involve remote monitoring, it could be auditing, and it could be auditing, it could be troubleshooting, it could just be break fix type of work. But as a result of the job that I am doing for you as an IT provider, okay, I might be coming in contact with PHI. That IT provider needs to be HIPAA compliant, okay? It might be your billing company. So if you have a billing service that you use for things like to manage things like your billing and your coding and all of that sort of stuff, especially if you're dealing with Medicare and other types of insurance products, that billing company also is receiving PHI. They need to be HIPAA compliant. Part of the reason why this becomes such a tangled web and why so many people actually fall under HIPAA more than you might even realize is because there is this chain that happens in that sharing of information between a covered entity and a business associate. So if you're a covered entity and you're working, let's say, with that billing firm, you would of course be required to execute what's called a business associate agreement with that billing firm before you share any information or data with them. Reason being is because 30% of all of the breaches that happen in healthcare are not at the fault of the direct healthcare entities, it's often at the fault of a vendor, right? So the government wants to make sure that in signing that business associate agreement, they understand that the data they are receiving is PHI, and that they have then direct liabilities to protect that information under HIPAA from a compliance perspective, okay? It makes sure it puts kind of a firewall between you and your vendor, so that if your vendor does something that leads to a breach, that's their fault, right? Or if you do something that leads to a breach, it's your fault, not your vendor's fault. right? And vice versa. Now, getting into why this is such a tangled web is because your business associate, so if you're listening to this webinar, and you might be a billing company, you might be an IT provider, you might be a software vendor, right? Any number of people. So let's say within your practice, you're using an EHR platform. That EHR platform is your business associate, okay? But that EHR platform could be hosting their software through a company like Amazon Web Services. Amazon Web Services then is their business associate, and the chain goes on and on and on and on and on, right? Anywhere that flow or exchange of information is happening, if somebody else is providing a service to your vendor and they are coming in contact with your patient information as a result in the same way, they all have to be HIPAA compliant. And without having those business associate agreements in place, you can't be compliant, okay? So understand, if you are receiving either from your patients or from your clients, if you as a business associate and as a vendor, any unique identifying information about a patient, you need to be HIPAA compliant, okay? And I know for many of you that may be bad news. You maybe have not wanted to address HIPAA in the past. And part of the struggle with HIPAA, okay, this is not the easiest thing to address, right? So what predominantly happens, many people misinterpret the law to be all about being very, very highly secure from a technical perspective. So many people will work with an IT company, okay, or else they implement a lot of things like themselves, like encryption, firewalls, anti-malware, auditing, monitoring, lots of different things that they install for the sake of becoming secure, believing that that is making them compliant. You might even be going above and beyond, right? So you might be doing your security risk assessment annually and have some remediation. You might be implementing some policies, procedures, and training. But if that's all that you're addressing, as you can see here, there's a lot that's being left on the table. Currently, for every 16 businesses, practices, or companies that get audited from a HIPAA perspective, only one passes. It's right around the 93% failure rate among government audits. And the reason being is because security and the concept of security is predominantly about managing risk. Okay? You're managing your risk of having data lost, stolen, compromised, hacked, whatever it is. You're managing the risk of a breach happening. Okay? Compliance is a very different beast because it is binary, right? You can either prove that you have fully satisfied the requirements of the law, or you can't, okay? And if you can't, that is when you could fail an audit and possibly be fined. Now, in kind of a summary, to kind of give you an idea as far as what that full extent of the law actually looks like, you boil all of HIPAA down to really a very specific set of annual requirements that the government expects you to be satisfying. The risk analysis requirements under HIPAA, kind of the baseline of that, okay? So as a foundation, the absolute most foundational requirement of HIPAA is that once per year, you are conducting a comprehensive audit and assessment of your company, okay? This could be an assessment of your IT, your physical location, your policies, procedures, trainings, operations. There's lots of different things that are covered under this, but as long as that's being done right and properly, you'll then be informed on every other aspect of your compliance because you'll be identifying your gaps, right? You'll know how to remediate them. You're going to be implementing proper policies, procedures, training as a result of that assessment. You'll be training your staff, making sure that all of that is documented, okay? And there are many people that are doing this, right? So for you in your practice, you may have a lot of these things totally covered. But again, the reason that failure rate is so bad is not because people are just being wildly negligent and nobody's doing these things. The problem is that oftentimes people do not have the ability to be able to prove it. And documentation, your paper trail, is really the thing that you're going to need most in the event of some type of a government audit where the government is asking questions, right? Because if you can't prove it to the government, you might as well not be doing it at all, okay? Now, from a HIPAA perspective, so let's say that you go through this process of assessing all of your organizational risks, right? You've implemented an effective compliance program, you've set up proper policies and procedures, you've trained your staff, executed business associate agreements. You go through that whole process, okay? when compliance is addressed properly, there are some tremendous benefits that can happen for your practice or your company, depending on who you are or where you're coming from, okay? And to walk through some of those, ultimately what compliance leads to is a much more efficient, standardized operation, okay? Because all of your employees will be reading from the same playbook. They'll be receiving the same trainings, right? Meaning they'll be happier. They'll be providing better service, more standardized care to your medical practice. What that ultimately means is that patients will be more satisfied. They'll be happier. They'll have an increased reason to trust you, right? Because they'll feel comfortable, okay? What that ultimately means is that you not only retain your patients more effectively, you'll actually be bringing patients in more effectively, because 68% of patients actually say that they don't think that their healthcare provider is protecting their healthcare information the way that they're supposed to. And of course, a nice benefit is that you won't get fined in the event of a HIPAA audit, okay? The reputational side of this is really what is most important, okay? What we often find is that in the event that you fail an audit, right? Because any type of an investigation done by the OCR is always public record. In the event that there's some type of an audit, okay, or something goes wrong, the greatest risk that you face is not even a fine, even though the fines can be substantial. It's reputational, right? It's in the communities that you're serving, the way that people perceive you. Because so much of the doctor-patient relationship or the vendor-client relationship is all about trust, right? And giving them a reason to trust you. Because ultimately, if you are not staying ahead of that curve, what people are hearing about the healthcare industry is not great, right? So there's nothing but bad news. If you go online or if you're watching the news, 17,000 medical records are breached every day on average. 89% of healthcare organizations have had a breach over the last 2 years. And if you want to know why, a single healthcare record, okay, so just one person's PHI could be sold for between 5 and 10 times more on the black market than a debit or credit card number. Reason being is because somebody's healthcare information could be used from anything from identity theft to blackmail to anything else, right? It could be held at ransom. There's lots of different ways in which that information can be used by cyber predators, and so it's prioritized, okay? But the healthcare industry is also incredibly vulnerable, meaning that they're easy targets, okay? The other issue with this is that 86% of the mistakes are administrative in nature. And what that means is that breaches and violations that happen within healthcare context are not usually a result of failing technology, usually failing people, right? Human error is what accommodates for the overwhelming majority of the issues and the breaches and the violations that happen, okay? And again, to look at that statistic, for people that experienced identity theft, okay, when asked, did your provider's negligence cause or contribute to identity theft? 53% would say, yes, it was actually my doctor that caused or contributed to this. 68% of people would say that they are not confident that their healthcare providers protect their medical records. So again, imagine what would happen in your practice or in your business if that number could go down to 0, okay? If everybody in your practice was confident that you were protecting their information, you would grow substantially, right? Because at the end of the day, what people are looking for is trust, right? And the way that this is often leveraged, again, is reputational in nature. People are looking online. 72% of patients will look at online review sites as the first step to finding a new doctor. After they pick a doctor, people will still go online and look at you as a way of validating their choice. I myself, I may have been seeing my dentist for the last 10 years. And I'm not totally unhappy, but I just don't know what else is out there. So I might go online and check to see what other people are saying and see if I could find something better, okay? For people that have gone through the process, at least our clients that have gone through the process of addressing the compliance requirements and posted our seal up on their website, they actually saw a 17% increase in terms of patient acquisition from people that hit the website, became a lead, and then became an actual patient of that practice. It helps with your retention efforts, builds trust. Because again, what they're hearing in the news is not great, okay? And all of this ultimately increases patient engagement, right? Everything will be standardized, meaning that your patients will have much less to be worried about. And to talk about the importance of trust for just a second, 20% of patients are lost by the average practice annually, meaning that 20% of your patients right now, if you're in the average, will up and go someplace else next year. 68% of the appointments that are coming into your practice are probably from existing patients, okay? Meaning that a lot of the patients that you have currently maybe are not even booking appointments. It's a lot of new people, okay? 83% of patients, and this is a very important one, 83% of patients would recommend a practice they trust. Not a practice that they received the most incredible service or care from, not a practice that had all of the bells and whistles, just very simply a practice that they trust, okay? Because within healthcare, there's really nothing more important than trust and feeling comfortable, because you're getting on the inside of a lot of the data and a lot of the information that people are not necessarily comfortable with sharing. You might feel like this doesn't apply to you, okay? You might be an eye doctor, okay? And the information that you're receiving about your patients, or a dentist, is not that extensive, okay? But even within that, this can be used as a way to leverage and increase the sales and the profits that you're making with the clients that you're bringing in. It's a way of making people more comfortable, right? And again, 82% of patients will stick to a practice just if they trust it. That's it. Because what makes patients loyal, right? Overall satisfaction with the service that they've received. Goes back to, again, reputation in the communities that you're serving, which is why having some type of an HIPAA issue can be so paralyzing and debilitating for many businesses. Satisfaction with the way that you resolve problems. And the last two, very important, deal with staff. Staff following through with what they say they will do. Staff treating patients with dignity and respect, right? What is the patient experience like in your practice? And do your patients have the same experience every single time that they walk in your doors? Right? Do you have that standardized of an operation? Because that's really what compliance will do. You may be wondering, you saw Nordstrom, Disney, you'll see the Starbucks logo on this slide. Those are three companies that absolutely in no way, shape, or form need to be HIPAA compliant at all, okay? But what they have implemented in their companies is remarkably similar to the type of compliance program that is required for HIPAA. The 7 points that you see there on the screen, these are called the 7 elements of an effective compliance program. This comes directly from the Office of Inspector General and Health and Human Services. It's what they outline, okay, as kind of the overall boilerplate requirements as far as what the expectation of HIPAA is. Not that you just be checking these things off of a box, but that they be made specifically effective for your practice. Starbucks uses this, okay? And it has helped them grow their business tremendously. And so do you want to know, like, even from a brand recognition perspective, Starbucks has become such a big and prominent brand because I can go to my local Starbucks here in New York and get a latte, okay? I can then get on a plane and fly to Los Angeles and go to a different Starbucks on the opposite side of the country, order the same latte, okay? Not only will my latte probably taste exactly the same, but the type of customer service that I received at those 2 different locations will also be remarkably similar. And it's because what Starbucks has done, go down the line here, they have very specific written policies, procedures, and standards of conduct that everybody is expected to follow, okay? They've designated somebody at each of their locations to make sure that they are followed, right? The next 2 ones, conduct effective training and education and develop effective lines of communication. That means what is decided upon by the executives at the top. They have specific methodologies in place for ensuring that all of that guidance, all of those policies, all of those decisions get clearly communicated, trickled down down to the smallest, newest employee that is in that organization, and that they be trained and educated on all of that, right? Oftentimes what happens is that we have this idealistic approach where we make these decisions as what might be the owner or the office manager or the administrator, whatever it is. But if that is not clearly disseminating down to your staff, okay, which you would have to be doing for compliance, it doesn't mean anything, right? Monitoring and auditing that, making sure that those standards are enforced. There's actual disciplinary guidelines in the event that somebody breaks them, making sure that you respond promptly when something goes wrong, right? If Starbucks can do that with a cup of coffee, okay, and it has helped them grow tremendously, imagine what would happen within your practice if you could do the same. And taking HIPAA compliance seriously is all that would help you to do. One more thing regarding the seal of compliance. Again, it's really just a differentiator like anything else that you might be using for secure payments or your payment processor. What we provide our clients with when they complete our process and get set up with our software is our actual seal of compliance. Okay, this can be put in your email signatures, on your website, in your literature. You can post it in your window. It's an actionable seal. Okay, so if anybody clicks on it, they'll actually be routed back to us, and we can then verify and validate everything that you would have gone through in that process to ensure that your practice reached a total state of compliance. Tremendously helpful. Practices, even aside from our company, okay, practices that are compliant and secure are 15% more profitable on average than ones that are not. Okay, so this can make a huge difference on your bottom line. So at this point in time, I'd like to go through some of the questions that we may have received. If there were things popping into your mind as we went through the webinar, you didn't yet ask it, now would be a good time to do so, because I'm going to go ahead and run through some things. All of my information is there. So if there's a question that you had, very specific, you didn't necessarily want to ask in the GoToMeeting, just write down my number, give me a call, or shoot me an email once the webinar is over. I'll do my best to assist. So let's just give it a quick second. Very good question. Okay, so question from Wolfgang. Does a cleaning company also have to sign a BAA? The answer is no, okay? And the reason being is because a cleaning company, the service that they are providing does not require them to handle PHI. But they might see PHI as a result of the service that they're providing, okay? Now, in a situation like that, you don't need a business associate agreement, you need a confidentiality agreement, right? So you might actually have a contractor working and doing renovations in your practice. That's going to be the same thing. Their job in no way, shape, or form requires them to be handling PHI. They don't need to be HIPAA compliant. They're not storing it. They're not doing anything with it. They just might see something in the practice that they're not supposed to. A confidentiality agreement is all that you would need in those situations. We have any other questions? It looks like that's actually the only question. So if anybody else has some curiosities, things they wanted to know about, now's the time, go ahead and ask. You'll see a link there at the bottom of the screen for a free security and compliance checklist. Feel free to check that out. It's a completely free resource. It's just to do a little bit of checks and balances for your own benefit and see how much of this you're actually addressing. And no other questions. Oh, let's see. Are secure text messaging applications compliant? Question from Julie. Okay, so that greatly depends on the secure text messaging app that you're using. So text messaging apps that are specifically designed for healthcare absolutely should be, and they need to be. So if you don't have a business associate with your current SMS service, or a business associate agreement with your SMS service, you might want to reach out to them, ask them if they're compliant, and if they would sign a business associate agreement, try to get that taken care of. That's going to become important. How do we keep our warehouse HIPAA compliant? Question from Jen. So Jen, in the realm of how do you keep a warehouse HIPAA compliant? So HIPAA, in terms of the safeguards that you need to have in place, you get three things, okay? It's technical safeguards, physical safeguards, and administrative safeguards. From the perspective of security, okay, a lot of physical safeguards would probably be more required within a warehouse context, but you would also need a lot of policies and procedures in place that are read and agreed upon by the people that are working in that warehouse, right? So from a compliance perspective, I'd want to go maybe, like if you reach out to me, I can maybe go a little bit deeper with you to understand your business. So there's a lot of print companies that we work with that have warehouses where they have a lot of people that are handling data and sending mailers and doing things like that for their clients. And we help them get through the process of addressing all of the things that would be required. If that's a similar situation to what you're in, feel free to reach out to me and I'll do my best to assist. So the BAA need to sign by another question from Brenda. So the BAA need to sign by organizations only that are working together. So if I'm understanding the question properly, yes, you only need the business associate agreement with a company that you're directly contracting with that is providing a service, to you. The next question. Is a BAA needed if a health plan sends files of eligible members to fitness centers? So the health plan would be the covered entity in this context. The fitness center could actually also be a covered entity or a business associate, depending on who you are and what you're doing, right? So, and like a regular gym, typically not a business associate or a covered entity, doesn't need to have specific HIPAA applications. If you are asking this question as the fitness center, you may need to be HIPAA compliant if you are receiving that information from the health plan. We would just have to learn a little bit more about the services that you're providing to your clients to identify exactly whether you would be a business associate or a covered entity. But either way, you would want to have a BAA in place with that health plan. Why is monitoring, so another question, why is monitoring practices that are not HIPAA, or who is monitoring practices that are not HIPAA compliant? Many of the practices that I visited are not compliant, but when talking with the office manager, they say that they are. Very good question. Okay, so from an enforcement perspective, okay, Health and Human Services writes the law and the regulations. The Office for Civil Rights is the enforcement body of HIPAA. Okay, so they're the ones that conduct investigations and audits, levy fines. That's on a federal level. Now, there could also be the CMS. The CMS also does compliance audits for Medicare. Okay, it could also be the State Attorney General. So if it's not escalated to a federal level, it could be on a state level that an investigation is being conducted or enforced and things like that. Okay, now what often happens, generally speaking, a small practice is pretty low risk in terms of getting a random audit by the OCR. What most often happens is that a small practice will be audited as a result of a breach or a complaint that is filed against them. The OCR receives tens of thousands of those complaints every single year, right? And they're required to investigate every single one of them, which often is what leads to some type of an audit. Could be a financial settlement if they fail, or they may be monitored for 6 years and have to report on their compliance structures. Overall, just a bit of a pain, right? So, but those are the main enforcement bodies. Now, what is interesting is that kind of what's happening in healthcare is that we see an evolution happening very similar to what happened in the financial sector, where in the banking world, it was you have to be compliant, and if there's an issue and you fail an audit, you're going to be fined, okay? It now is you have to be compliant and you need to report on all of this data on a quarterly or an annual basis to ensure that you're compliant, right? It's very carefully monitored. It isn't yet being done within healthcare context, but we see the government moving in that direction just because the industry is doing so poorly from a compliance and a security perspective. No other questions for the purposes of today. So again, all my information is right there, folks. So if you want a little bit more clarity or you want to have a chat, don't hesitate to reach out to me. Also, keep in mind that when you close out the webinar today, it's literally a 2-question survey that you're going to get that just helps us get a better understanding of who we have on this webinar and making sure that we're putting out content that's relevant to you. And also just if you're interested in learning more about Compliancy Group, please answer those questions when you hop off. It's just helpful for us. Other than that, I hope you all have a great day. It's a very beautiful July day here in New York, so I hope that you enjoy the weather wherever you are. Thank you so much for your time.